I'd like to re-invite Dr. Nebojsa Kovacina so that he can present the national survey results. This was an event that you might have participated in last fall, and he's going to really show the basic lessons that can be learned from the data that was collected, and he's here as a speaker. I'm going to present him a bit more in detail than before. Dr. Kovacina is a family doctor in Montreal. Since 2017, he's director of the Program for Continuous Improvement of Quality at the Department of Family Medicine of the University of McGill. He played a consultative role in different areas and different levels, both provincial and federal, and he was in charge of the family doctors, and he was involved in different initiatives, namely improvement of primary care at all levels. He is also counselor, medical counselor and expert within the group Innovation Santé. That's the organization that is in charge of implementing the program at the Center and the Correctional Service of Canada. He's one of the founders of the Académie Quelque Santé, and he's one of the two persons in charge for projects of health care in Quebec. And once again, the presentation, PowerPoint presentation, is going to be now in French, but it is going to be indeed translated, and it's going to be made available to you.
So do not hesitate to take notes to keep track of your reflections. Dr. Kovacina, the floor is yours. Thank you very much. Can you see my presentation? Thank you for this presentation, for this introduction. So today I'm here with you to present you the results of the national survey. We are going to talk about some statistics that will help you to imagine what Canadians face in primary care. We will share their wishes and their impressions. I'm Neb Kovacina. You can call me Neb. Don't call me doctor, please. So we will try to demedicalize the whole process with you. We are not just doctors around the table. We are two doctors here giving presentations, but there will be other experts, professionals, and people who are not doctors. So as it was said earlier, I'm the co-leader for the project OurCare in Quebec. I'm first of all a family doctor. I have been for the last 15 years. I work in Montreal. I work in Côte-des-Neiges. It's a neighborhood of Montreal that counts many newcomers and vulnerable communities. I work at a clinic that takes care of education for students and residents. I also work at the hospital. I follow a pregnant woman. So I'm also at the University Department of McGill. And there I worked with Dr. Karen of Toronto on many projects. So that's how we were introduced to each other. So now let's start. So the national survey was that a huge survey that was carried out in Canada, across Canada. Sorry. So this survey took place before we started the panels. And that survey, you can access it on our website. We will give you the link. You can navigate easily from question to question to see different results and compare different Canadian regions. So that survey was carried out between September 20th and October 20th, 2022. we had an analysis of almost 9,300 people who completed the survey. On the right, you see the total. There was approximately 27% of people who answered in French, and so we have approximately 1/3 of all participants who lives in Quebec. And those questions were combined and weighted according to age, gender, education, income, language, and region. For example, if 27% of participants were Quebecer, then we would weight those questions according to the proportion of Quebecers in the country in order to adjust the national number, the national average. However, there were limitations. Some voices were not heard, such as newcomers, indigenous communities, and marginalized communities. So we always need to keep that in mind. So this is an image of what this survey looks like, and here are the results. So on this website, you can find those results and analyze them. So I'm going to present some of those statistics that you can keep in mind for your future discussions. And if you have questions, I could access those data to illustrate some issues. So first, we're going to talk about the experience of primary care. So globally speaking, we found that over one adult out of 5 has no family physician or nurse practitioner. So compared to the Canadian population, that gives approximately 6.5 million people, so 22% of the population aged 18 and more has no family doctor nor nurse practitioner. What we realize is that some regions are better than others, and here in Quebec, we are at the end of the list. So Quebec is amongst the worst, and we have 31% of adults who have no family doctor or who are not registered with a nurse practitioner. So Quebec and the Maritimes region are the worst, and they are 71% of people never had any nurse practitioner. So 1 out of 5 have no family doctor, and in Quebec it's 1 out of 3. So amongst people who say they have a family doctor or an NP, we ask them, does your family doctor treat your urgent issues? And then we gave some examples. For example, before 9 a.m., after 5 p.m., on the weekend, Saturday or Sunday. And the answer is that generally in Canada, 37% of people who do have a family doctor or an NP cannot be seen before 9 a.m. or after 5 p.m., nor during the weekend. 27% of those people do not know if those services are available. And in Quebec, the data is similar. So here we're talking about people who are already registered with a family doctor or an NP. I'm sorry, some graphics were not translated, so it will be mixed English and French. So amongst people who tried to have an emergency appointment, only 35% managed to have an appointment on the same day or the next day, and 1/5, meaning 21%, had to wait 2 weeks or more or never got an appointment for an emergency issue. So this was mentioned amongst the group that already had a family doctor. So this problem of accessibility. Now let's look at people who are not registered with a family doctor. Here we are talking of 1 adult out of 3 in Quebec. We ask them a question: do you see another health professional? No. In Canada, this amounts to 12%. However, in Quebec, it's 22%. So we have a higher part of the population who are followed by another health professional. And when we ask them who that person is, who they see when they don't go to the family doctor. So all those people who do not have access to a family doctor or an NP tell us that they go and see specialists because they are already cared for by those specialists. They go to pharmacists. And then other like a nurse, mental health specialist, social worker, etc. We see that the category other has been selected a lot. So we asked them to name those other health professionals. And many of them said that it was a massage therapist, nutritionist, private health professionals. We did not extract all of those information in order to see the percentage of each of those other professions, but it is important to know that we have that category too. So if we look at each region, we see that in Quebec, there were lots of participants who answered other compared to the rest of Canada. So this brings us to think that in Quebec, people make appointments with those other categories of professionals. We see that the pharmacists, for example, are well represented, specialists a bit less than in other provinces, but a big portion of those people go and see those other professionals. So this is an important detail to keep in mind. And then we ask them if they have to pay for healthcare. And for those who do not have a family doctor or an NP, 1 person out of 5 declares that they had to pay. In Quebec, it's even higher. It's 1 person out of 3. So 37% of the participants said that they had to pay for the services. And when we asked them why, what services those costs were for, 80% said that they paid for the appointment itself, for the consultation. And then we have the medication and administrative fees. So this is lower compared to the rest of the country. However, 80% of the costs are for the appointment itself. Then when we look at the different places where people go for their consultation, here we are still talking about people who have no family doctor and no NP. 50% of them go to clinics without appointment. 27% say that they go to virtual clinics without appointment, and 24% say that they go to the emergency room. So the participants could select more than one answer, and that's why the total is over 100%. Then, how to find a family doctor? Here's the answer. 29% of the participants tried to find a new family doctor or a nurse practitioner, and most of them have been looking for less than 2 years. So at left, the question is, are you looking for a family doctor? Approximately 70% said yes. And amongst those who said that they were looking, you can see on the right graphic, in the middle, we have 35% who already have a family doctor or a nurse practitioner, so they are looking for a new family doctor. And then there are 62.6% who do not have a family doctor or nurse practitioner. So 1 person out of 5, 17% that do not have a family doctor or nurse practitioner also do not search for a family doctor. And so we asked them why they were not looking for one. And they said that they feel healthy and that they don't need one. So 35% of the participants answered that they felt healthy and that they did not need a family doctor. In Quebec, the statistics are even higher. It's close to 50% regarding that reason. I think it's approximately 46% of people who answered they felt healthy. And then in Quebec too, the category other is the most important category. Amongst those who are looking for a new family doctor or nurse practitioner, we ask them why. For those who already have one, we asked them why they were looking for a new one. In Canada, the most represented category was I'm not happy with the care provided. And in Quebec, the highest category was my care provider is retiring and I need to find a new family doctor. So 38% of participants said that they were looking for a new family doctor because their family doctor was retiring. So this is reassuring as a family doctor in Quebec. Apparently Quebecers like their family doctors. So then we asked participants what was the most important thing for patients. And this is similar in all regions. 98% of participants say that it is important for anyone to be able to have access to a family doctor in order to make an appointment regularly. Here you see what patients value most about their family doctor or nurse practitioner. And so what they value most is that those professionals should know them. 92% of the participants selected that priority. 91% said that those professionals should make it easy for them to get care during the day. 88% says that those professionals should be able to provide most of the care. 88% also selected that they should coordinate the care that they get from multiple places, and 87% said that it is important for them that those professionals stand up for them. So these are interesting statistics to know what the population thinks about their healthcare professionals. Also, 88% think that it is important to have a family doctor or NP close to where they live. And regarding the access to information, the participants also want better access to their medical record. 75% think that it is important to have an online access, and 93% think that it is important to have one personal health record that all professionals of the province can use. Now we are going to see the clinics without appointment and remote consultation. So we asked during last year to many participants. How many of them communicated with their family doctor? 71% communicated through the phone, 18% through email, and only 5% through video. When we ask them about the virtual clinics with no appointments, we ask them about those new services that allow for an enhanced communication through video or phone. However, those patients do not know these doctor. There is no follow-up, and that doctor has no access to their health record. So 57% of participants do not want to use those services if they are offered by a private company. 70% of them do not wish to use that new service if the company managing that service receives payment from pharmaceutical companies or if it is owned by a pharmaceutical company. Then 78% do not want to use those services if they are not free. And 84% of the participants do not wish to use those new services if the company managing that service sells their health data to insurance companies or pharmaceutical companies. So these are interesting opinions of the population, and there seems to be some consensus here. Regarding our primary care in multidisciplinary team, we heard about this a bit earlier. It is reassuring to know that team-based primary care are supported by the participants, and 90% of respondents said they were comfortable getting care from another team member if recommended by their own family doctor or NP. So when we asked them which health professionals would be most important to have as part of the team, they said nurse practitioners, nurses, pharmacists, psychologists, physiotherapists, social workers. So this supports the idea that we are entering into an interdisciplinary model, and the population is our residents are aware of it and support that model. So here we talk about primary care reimagined, and we ask them their opinion. And most of participants were favorable in an organization of primary care similar to the public school system. And they favor solutions that allow them to have access to only one healthcare professional. So here, this concept of continuity that is important again. 91% of them were willing to see one NP consistently for most of their care. In Quebec, I think it's over 95% of participants who say that they are followed by a healthcare professional who is a family doctor. So less than 10% of patients are followed by a nurse practitioner. And 76% are willing to see any family doctor or NP in a practice, even if it meant not seeing the same person consistently. And 65% were willing to choose from a list of available family doctors or NPs close to their home instead of being able to choose anyone in the province. So patients are open to all those ideas. I think that's it for the key elements. So thank you so much for your attention. And this is a dynamic tool. You can search it and navigate it using different questions asked in the survey. We encourage you to use this tool. And if you need to have more specificities for Quebec or for some specific population, you can tell us and we will help you.